Province announced today will provide interim funding for a life-saving drug known as one of the most expensive medications in the world. It's called Solaris, and it costs an estimated $500,000 a year per patient. It is used to treat an extremely rare disease called AHUS. The announcement comes on the heels of an appeal for funding. A boy from Vaughan who got the drug through a clinical study explained the difference it makes.
Once I started Solaris, I got healthier, and now I'm back at school, doing the things I love.
Today, Joshua has a paper route. He plays soccer and the drums. For our family, access to Solaris meant that we got our little boy back.
About 30 people in Ontario have the disease, which causes blood clots and can lead to heart attack, stroke, kidney failure, or even death. The province says patients can now speak to their doctor about accessing this drug.
It has been a topic of some debate here in Canada recently. Should parents vaccinate their kids against measles? Well, today, the World Health Organization urged European countries to step up measles vaccination efforts. There are thousands of cases of the disease there. Here in Canada, health officials are investigating how a toddler who never traveled outside of her hometown of Elliott Lake, Ontario, became infected with the measles. The girl, who's under the age of 2, is now the 19th case in Ontario since late January. The other measles cases have been diagnosed in the Toronto and Niagara areas. A separate outbreak in Quebec continues to grow, with 26 cases now reported.
It's being touted as a medical marvel. 3 Austrian men became the first patients to undergo a bionic reconstruction of their hands, which were badly injured in accidents.
These patients have lived without hand function for about 10, 15 years, and they know what it means to live without hands.
The patients can now control robotic hands using nerves and muscles transplanted into the arms from their legs. The innovative surgery includes voluntary amputation. One of the recipients describes it as a new lease on life, allowing him to do simple tasks and play with his children.
Time now for a look at the latest health and lifestyle news. Here's Pauline Chan.
A recent survey by the New York-based Women's Sports Foundation shows in certain sports, female athletes suffer from concussions at a significantly higher rate than male athletes. But the reasons for this difference aren't clear. Dr. Charles Tatter says studies have been showing these gender differences for several years now. Female athletes in basketball, soccer, and hockey suffer concussions with more frequency than their male counterparts. And across all sports, the recent study by the Women's Sports Foundation shows female hockey players suffer the highest rate of concussions.
That girls are more susceptible than boys, and it seems to hold for both high school and college athletes, and we really don't know why.
Sherry Piper was a national and Olympic hockey player for Canada. She was diagnosed with several concussions in her career, mostly during her college years.
It is a game, and even though it's considered non-contact,